Every week, Tororo Main Hospital admits about 10 to 12 COVID-19 patients for treatment and management. This is in addition to hundreds that are being transferred to different regional referral hospitals within eastern Uganda. But as the hospital admits fewer patients, the biggest challenge here has been feeding patients, since most of them have been abandoned by their relatives who fear contracting the virus.
Because everybody fears to be infected, and then bringing in food is seen as something which is making people to get, perhaps somebody can get infected by interacting with their patients.
The dire situation is said to have been leading to the escalating community infections, since a number of patients could sneak out of the hospital and end up mixing with the locals.
Tell somebody we are admitting you, we see your condition is not good, they will tell you, let me first go and consult with the home people, and they don't come back. Such a case goes to the community, and that is again continuing to spread.
With the condition becoming a public concern, a section of private sector players like Tororo Cement have come to the rescue of COVID-19 patients by providing them with food.
We observed that these patients, especially COVID patients, are not being taken care, and they are not they are not able to eat well and not able to improve their immunity. So I discussed with some food service providers, and I said if we can provide them breakfast, lunch and dinner.
They provide breakfast, which has a carbohydrate, a fruit, and either dry tea or milk tea. They provide both, depending on who wishes to have what. Then we have a lunch and then a supper. It is a balanced diet accompanied by fruits.
The distribution of food to the COVID-19 patients, which started from the time the second lockdown was announced, is said to be yielding fruits.
Everybody knows that if you interact with a COVID patient, you can easily become infected. With this era of few PPEs, some people were really abandoned there. It is a true story. But I think it is now a little bit much better. When people know that, okay, I am going there, even without my relatives. Some people send their relatives away.
In addition to that, we are also providing the food around 3 tons to 4 tons of posho and beans to Karamoja area, because that area is dry and they don't have food. And the people who were used to be in the mountains, they have come down on the ground because they don't have anything to eat there.
David O'Shea, this is my story.